Fix your Achilles tendonitis today. As some of you might know, Achilles tendonitis can be a very debilitating condition that can affect your ability to walk, run, or even move. Today we'll be going through some cost-effective, proven, and research-based ways for you to overcome your injury and get you back moving again. Please feel free to drop a like and subscribe for more updates and information about ways you can overcome your aches, pains, and overcome your injuries today. Before we dive into today's segment, it's important to remember that the information in this video is for educational purposes only. It should not be considered as medical advice, diagnosis, or treatment. Always consult with your doctor or local healthcare professional for further advice. So, what is Achilles tendonitis? Well, it's a condition that can really affect your ability to maintain an active lifestyle. The Achilles tendon itself is a tough band of tissue that connects your calf muscles, or your gastrocnemius and your soleus, to your heel bone, also known as the calcaneus. And it plays a crucial role in helping us transfer forces from the ground to our bodies during activities like running, walking, jumping, anytime you're upright. Now, when this tendon becomes injured, that's when we have our condition called Achilles tendonitis. And it's often due to a variety of factors like overtraining, or suddenly increasing your training load without proper preparation. Now, the typical signs and symptoms of Achilles tendonitis often starts quite subtly. So in the beginning, there can be some pain and stiffness in the Achilles tendon. And as it progresses, you might experience a bit of swelling and even a thickening of that tendon. So if you start to feel pain in the lower calf area around the Achilles region, and we'll have a graphic up here so you can see where that is, pay attention because it's most likely that you have an Achilles tendon issue. Now, an important thing to distinguish is the difference between the terminology tendonitis, which infers inflammation along the tendon, and tendinopathy, which infers more of a structural change within the tendon. Now, more and more health professionals are beginning to adopt the term tendinopathy, as a lot of the tendon issues that we do see are non-inflammatory. This means that your traditional approach of icing, resting, and taking anti-inflammatories might not necessarily be the right approach to you. And this is shown in many papers, many good research papers and articles. And this first concept was propelled forward by renowned tendon expert and researcher Jill Cook. So now, rather than focusing on trying to reduce inflammation, we want to try and strengthen the tendon and find ways of reducing strain through that structure. So how do you know whether or not you've got Achilles tendon issues? Well, the first thing is looking out for signs and symptoms. So the most common sign and symptom is a pain at the back of the Achilles tendon. Typically, you can pinpoint this with the finger, not always the case. The second thing is thickening of that tendon. Is the tendon thicker when you compare that to the other side? Is there signs of swelling as well? Typically, this is accompanied by a recent increase in physical activity. So if you're a runner, you've upped your volume for the week, that will be a typical precursor towards you getting the condition. The second thing is looking at physical tests that can trigger your Achilles tendon pain. One of the common ones I found was a pinch test. So pinching the Achilles between the outer and inner side of that tendon. If that reproduces your pain, that is another symptom. And the second one is single leg calf raise test. So if you do a single leg calf raise and you feel it in that spot, that's another sign that you may have Achilles tendinopathy. The third, and not necessarily essential diagnostic tool we use, is imaging. So typically, ultrasound is the go-to if we need extra information, but typically that's not necessary for us to make a diagnosis. Now, one important thing to understand is that not all Achilles tendon issues are alike. There are many types of Achilles tendon issues, the most common being insertional and mid-portion Achilles tendonitis or tendinopathy. So you often find that insertional Achilles tendon issues occur at the base of the heel, so lower along the tendon, as opposed to the second type, which is called mid-portion Achilles tendinopathy, which occurs in the middle part of the Achilles tendon between the heel and where the calf starts. Now, this is important because it affects the way we rehab our Achilles tendon. The subtle changes that we need to make ensure you actually improve your situation rather than worsen it. So what is the best treatment for Achilles tendinopathy? Is it anti-inflammatory? Is it shockwave therapy, orthotics? Not necessarily the case. Sometimes the best things in life are often free, and this is the case for Achilles tendinopathy. The gold standard of treatment is making lifestyle routine changes to your day-to-day activities or your exercise routine and exercise. The important thing to understand is that Achilles tendonitis or tendinopathy is actually quite a straightforward condition to manage, although it can take a bit of time, especially if you had the condition for a while. So what type of exercises are the best for Achilles tendinopathy? Well, pretty straightforward, calf raises, not just any calf raises. A lot of research supports performing eccentric calf raises as a way of strengthening up the tendon, reducing pain, and getting you back to doing the things that you want to do without unnecessary invasive treatment. But what is a eccentric calf raise? Well, it's basically a calf raise performed slowly as you come down into a stretched position. Now, there are two variations of the calf raise when you perform. One with the leg completely straight, and number two with the knee slightly bent. The reason why is we want to target both the calf muscles that insert into the Achilles tendon. The first one being the gastrocnemius, which is the outer calf muscles, and that's targeted by doing straight-legged calf raises. Whereas the soleus, the deeper calf muscle, that's targeted by doing the calf raises slightly bent. So it's important not to neglect doing both these different calf raises variations, or else you'll be missing out on basically half of the treatment and recovery process. Now, the next important thing to consider is whether or not you have insertional or mid-portion Achilles tendinopathy, because the way we do these exercises will change depending on which type of Achilles tendon issue you have. So for insertional Achilles tendon issue, you don't want to be dropping the heel too low into the eccentric phase. So when you're doing your calf raise on a step, you don't want to be lowering the heel too much, reaching neutral to begin off with, and slowly dropping it over time if you need. As opposed to a mid-tendon issue, you can go all the way down and feel a nice contraction at the back of the calf as well as the Achilles. To summarize, if you go insertional, don't go too low. If you've got mid-tendon issues, you can go low. But at the end of the day, it's important to listen to the body to see whether or not you can tolerate such a movement to start off in the first place. So your next question is, how many calf raises do I need to do to improve my condition? Well, one of the earlier protocols called the Alfredson Protocol, named after the founder, an orthopedic surgeon, Dr. Harkin Alfredson, they looked at patients doing 3 sets of 15 4 times a day, which is essentially about 180 repetitions over 6 weeks. And they found that people's conditions improved, symptoms improved, as well as they were able to maintain a more active lifestyle. But what some researchers also found was that this protocol actually aggravated some people's symptoms and conditions. And the reason why I think this doesn't work is because a one-size-fits-all approach only works if everybody is the same, and not everybody is with this condition. So my recommendations are based on 4 principles. The first being, let your pain be your guiding factor. We don't want you working into 10 out of 10 pain. There will be a little pain associated with Achilles tendon rehab, just because you want your tendon to adapt to the load in order for it to get stronger and more tolerant to the things that you eventually want to do. So you want to work within 3 to 4 out of 10 pain, no more than that. You don't want your future sessions and rehab sessions to be compromised. Number 2, you want to be logging and tracking how many sets and reps you do in a day. Number 3, you want to progressively overload. Every good session you have, you want to be trying to aim for a little bit more the next session. That might mean more reps, more sets, doing it single-legged, doing it with weights. And the fourth principle is have adequate rest days in between. For some people, this can be quite a provoking rehab protocol. So what I recommend is once every 2 days is enough. Rest days are important for us to find a right balance between strengthening up the tendon but giving the opportunity to recover and rest so that stress doesn't build up and actually worsen the condition. So if you find that double-legged calf raises are too easy, there are ways of trying to make it more challenging and appropriate for someone at a higher standard. The first, more repetitions. So if you can tolerate 3 sets of 10, aim for 3 sets of 12 instead during your rehab. The second is more sets. If you can do 3 lots of 15 well, do 4 lots of 15. But remember, let pain be your guiding factor. You don't want to work more than 3 to 4 out of 10 pain, or else you pose the risk of aggravating your symptoms. The third way to progress is to add weight. You can use a backpack, fill it up with water bottles in order to get more weight, bricks, whatever you can find. The fourth would be doing a single leg calf raise. So instead of calf raising your body weight with 2 legs, do it with 1 instead. And the fifth, a combination of these. You can increase the reps and sets, or you can do a single leg with a backpack. These are all ways to try and progressively overload the tendon in order for it to get stronger and get you back to doing what you want to do, like running, jogging, whatever. Some of you might be asking whether there are any more exercises you can do to fast track your recovery, and absolutely there is. I don't have the solution to all your problems because everybody has a unique set of situations and circumstances. And that's why seeing your own physio or getting in contact with one of our physios at digitalphysio.com is important for you to get a tailored and custom treatment plan that works towards your goals. So for example, if you were a volleyball player or a basketball player and you needed vertical height as a priority and your Achilles tendon was limiting you, plyometrics might be incorporated in the later stages of rehab before you get back into playing that sport again. So it really depends on your situation about what type of exercises are suitable for you. But rule of thumb, we want to be strengthening up that tendon, and the easiest and I guess most straightforward way is eccentric calf raise, especially in the mid to early stages of your recovery and rehab. So what if modifying your training program and these exercises don't work? There are other treatments that you can consider that might help fast track your recovery, including finding proper footwear, wearing orthotics. I even find heel raisers that you can pop in your shoe. They can help offload a bit of pressure on the tendon, especially if you've got insertional Achilles Tendonopathy. Shockwave therapy can help for some people, although that can be very costly. Each session costing around $100. You might need 3 to 4 sessions. It could be $300 to $400 commitment without guaranteed results. Taking non-steroidal anti-inflammatories may also help, particularly in the early stages, although that can affect your gut in the long run. Massage, electrotherapy, taping, and worst comes to worst, surgery, which most people don't ever resort to. These are some other ways you can manage Achilles tendon issue, but the gold standard, in my opinion, is basically just trying to rest as you can or modify your program appropriately and performing exercise to strengthen up that tendon. And that's it. This condition is annoying, but it's definitely something that is quite manageable and people do get better over time. The real takeaways from today's video is to make sure you're doing your eccentric calf raises. Make sure you're modifying your program so you're not overtraining and getting rest in the meantime. Now, if you want a bit more information, I've dropped a link to a blog post on digitalphysio.com. This will be a bit more comprehensive in the information we talked about, so it might give you a bit more information that we weren't able to cover in this video. Please feel free to leave something in the comment section, whether it's a question or any feedback about videos for the future. If you found this information useful, please show support by liking this video and sharing it with your friends who might find it beneficial. Feel free to drop your questions or comments below and stay tuned for any more health insights on our upcoming videos. Remember, your health matters, so take care and stay informed.